So good afternoon, everyone. This is Connie Burke speaking, Associate Commissioner for the Division of Grants Management and Special Projects here at OASAS. I'm joined by members of the project management team who are working on the implementation and use of the funding, and also joined by colleagues from Department of Health. So I would like to turn it over to Val to introduce herself.
Hi, I'm Valerie White. I'm the Deputy Director at the AIDS Institute with the New York State Department of Health.
And Shaimei, did you want to introduce yourself?
Hi, good morning, everybody. I'm Shaimei Gonzalez with the Office of Drug User Health within the New York State Department of Health inside the AIDS Institute.
Great, thanks. And then Lucia and Celine, we can't see you, but we can hear you.
My name is Lucia Perfetti Clark. I'm the Project Director in Grants Management and Special Projects.
Hi, good afternoon, everyone. I'm Celine, and I'm a Project Coordinator with the Division of Grants Management and Special Projects at OASAS.
Terrific. Thanks, everybody, for that introduction. This is our quarterly Opioid Settlement Fund community meeting. I'm happy to see that folks were able to join us this afternoon. And we're going to go ahead and get started with the PowerPoint. If we could go to the next slide. So check on that first bullet, welcome and introductions. We're just going to, for today, do a quick refresh and update with regard to opioid settlement funds. We want to talk a little bit about what's been happening and where to see what is happening, and give an opportunity to Val to provide an update and certainly answer any questions that folks may want to pose. And so with that, if we could move on to the next slide. I think check, and check for most of these things. In terms of the meeting purpose and frequency, for awareness, when the opioid settlement funds were made available, and OASAS as the lead agency was looking for opportunities to make information available, not only to our systems that we're working with, but also to the larger community. And so in partnership with OMH and DOH, we were holding these quarterly meetings. And so it's an opportunity for the state agencies to provide any updates, to share information around the work we're doing with the opioid settlement funds. And currently we're holding this meeting on a quarterly basis. We do record, as I mentioned at the beginning, and we do post the meetings on the webpage so that if you miss one, you can always listen in. Moving on to the next slide, I'll take a second to Chris Smith, who is, I believe, Chris, your title is now Associate Commissioner at OMH, has also joined us on today's call.
Good afternoon.
So in terms of just kind of a refresher, New York State received a portion of the national settlement with regard to the opioid litigations that were happening across the country. The amount that is coming to New York State is being managed and flows primarily through OASAS. And then OASAS, in partnership with OMH and DOH, are identifying opportunities for funding and are sharing information. And so hence both DOH and OMH joining us this afternoon in this meeting. Also know that although OASAS is the lead agency, the lead state agency to manage this effort, we do work closely with the Opioid Settlement Fund Advisory Board in terms of recommendations on how to utilize this funding opportunity. And of course, as you know, we have our quarterly community meetings. Here we are right now. Next slide. With regard to the Opioid Settlement Fund Advisory Board, it is comprised of 19 appointed members. And that group meets on roughly, I'd say roughly a quarterly basis, but they do meet periodically to discuss the use of the opioid settlement funds and then make recommendations to the state with regard to how to utilize the funding. Oops, if we could go back, thank you. Know that during the Opioid Settlement Fund Advisory Board meetings, there is opportunity for the public to participate, to provide input. So please note that if you do want to participate in one of these meetings, if you do want to share experience or provide your input with regard to the use of dollars, that's an opportunity that you can take advantage of. The board does issue an annual report that is due the November 1st of each year, and OASAS does post the report to our webpage. So if you go to the OASAS webpage, you'll note there is an Opioid Settlement Fund Advisory Board portion to our webpage. The link, the address is right there on the slide. And there you will find information on the board, its charge, and each of the reports that have been issued to date. So far we've had 2 annual reports issued by the board. Next slide. In the first year of the work by the board, they did identify 10 priority areas or focus areas that they saw appropriate for the use of funds. My apologies for that. So we have these 10 priority areas, and in the first year of the first 2 years, I apologize, of the recommendations included among these 10 areas also the portion of funding that should go to each of these. So the board had recommended in the first 2 years that the state make 22% of the funds available for harm reduction programming, 12% for treatment, and so on. That was for the first 2 years. And then in the most recent report, the board did recommend for 2025 a change in the percentage allocated for each of the priority areas. So here you see in green the amount that the board recommended. So after the 2 years of experience with this work, you can see that they did make changes to the allocations. I'll point to investments across the continuum, which is in the top row in the middle as an example of where previously they had allocated 16% for that effort, and they revised that number to 28%. And you'll see the changes as you look up at the slide for the other focus areas as well. Next slide. Here we have, just again, the link which Celine also put in the chat. So there is a link to the Opioid Settlement Fund page in the chat. Certainly here is the information noted on the screen. And hopefully everybody has this bookmarked and you do go and review the information periodically because we do make updates. Next slide.
Oh, sorry, Connie. There was a question in the chat. What is investments across the continuum? If you wanted to just address that.
Oh, sure. So in terms of investments across the continuum, we are looking to ensure that we're investing the dollars across the continuum of care. And 2, also looking at being sure that our efforts expand beyond, say, only the treatment setting. I say that there may be a very clear, much more concise definition in the report too, which we can refer to and indicate.
May I add also, Connie?
Oh my gosh, Debbie Davis, of course you can. Thank you.
I would also just share that the board made recommendations that in order to have a continuum of care, we also must invest in the workforce. So a lot of those funds are actually being used to support initiatives that are building the workforce to work in the SUD field as that recommendation aligns very much with our strategies and priorities at OASAS too.
Perfect. Thanks, Debbie. And happy to see you're on. I didn't realize you were on. Okay, so then moving on, in addition to the Opioid Settlement Fund Advisory Board information that's available on our webpage, we also have our Opioid Settlement Fund tracker. And so we do have information for both fiscal year 23 and 24 available on the webpage. In both cases, we do include information that shares and shows the amount of dollars that are going into each of the initiatives. So you'll see on the screen where we have the date of the release of a procurement opportunity, the name of the initiative, how much we're investing in that initiative, and the status in terms of awards for that initiative. So you'll see that a number of these do have an indication that awards have been made. So in that number of awards column, you'll see an actual number. Where you see in process indicated, that is where we have, it's actually an active RFA. Once we have information on awards made, we will update the information. You'll also note that under initiatives where where OASAS has issued something, we do have a hyperlink there. So you can click to learn more about the comprehensive low threshold buprenorphine services. What is that RFA? What do the services entail? And so on for the others that are listed here as well. In addition to that, we do also have information on each of the priority areas and the dollar amounts allocated to each of the priority areas. So I encourage you, if you haven't looked at the tracker, to go to the tracker. And again, we are maintaining that information so that you can look back to 23 and you can see the amounts for 2024. Next slide. Another aspect of the Opioid Settlement Fund work that OASAS is managing is distributing the regional abatement. And so for within the Opioid Settlement Fund appropriations, there are dollars that go directly to OASAS that are part of our state budget that we have the ability to use for procurement opportunities. A portion of that we share with DOH and of course include OMH providers in some of the procurement opportunities we've issued. There's also the regional abatement dollars. So there are dollars that are specifically identified to be distributed across the state by region. OASAS has taken this opportunity to provide dollars directly to the local governmental unit to utilize those dollars. And within the regional abatement, there's also specific amounts for other litigating entities and the 5 large cities within New York State. So as you see on the screen, we have the numbers for both 2023 and 2024, the numbers regarding the regional abatement amounts made available. And I think that, you know, particularly important to point out to folks is that the number or the amount of money available does change from year to year. Know that there are a number of different settlements that feed into and are part of this larger opioid settlement fund. And how each entity decided to pay out the money and over what period of time, it could be different for each settlement. And so each year the amount will be different. And of particular importance here is the fact that the amount that was made available in 2023 was a very large amount. And you'll see that there was a decrease in 2024. So know again that the number could decrease. There's a chance it may increase between years, but it is a moving target in terms of what is the amount per year. Next slide. So in terms of the initiatives by focus area For harm reduction, OASAS had issued a comprehensive low threshold buprenorphine RFA. We have 15 providers serving 21 counties right now. Also for harm reduction, we've made available a vast amount of harm reduction supplies. And so we are making available naloxone and fentanyl and xylazine test strips. If you go to the OASAS data landing page, there is information on the amount of material, amount of supplies that we have made available, and we do update that on a monthly basis. Moving on to treatment. So difficult to see there, but the comprehensive integrated outpatient treatment program is another of our efforts. And this is specific to the OASAS system. So when we are talking about integrated outpatient treatment, what our aim is to ensure that there are locations where an individual who's seeking treatment is able to access all 3 opioid medications for opioid use disorder. So they're able to access methadone as well as buprenorphine or naltrexone and receive outpatient services. So it's really trying to create a robust kind of one stop for outpatient treatment. We're currently supporting 28 providers in making the transition to an integrated location, and that work is happening in 24 counties. This is an ongoing effort by OASAS, and this is work that some providers had initiated even prior to the funding opportunity we made available. Moving on to investments. So we currently have 3 four-year schools and 10 community-based educational institutes that are making paid internship opportunities available as part of a professional scholarship program. In August, we are going to have 15 community and technical colleges who will join in this work. So we're very pleased to see that there is a broad distribution across the state in terms of geography with the institutions that are participating in this work. And there we've already, seen great success in terms of enrollment in those programs. And then we are working on establishing a leadership institute, which would provide opportunity for managers within our programs to actually attend a leadership institute, learn and have a professional development opportunity. Next. Under priority populations, we have 18 providers that are delivering in-community services in 29 counties. And when we talk about outreach and engagement, here OASAS is talking about really kind of 2 levels of engagement. We do have a clinic model whereby our outpatient providers are going in community to meet with clients, to identify individuals who perhaps would not come into a clinic for treatment and would prefer to meet with clinicians out in the community. They have the ability to do that. They also can provide ongoing service in the community. With regard to the street outreach model, this is a lower threshold engagement opportunity. This is work that's happening in New York City and in cities across the rest of the state. And it really is a chance to provide harm reduction supplies, make an initial introduction to individuals who may be in need of service, who may be actively using, and we want to support and encourage them in terms of more safe use and accessing resources that may help them. And then there is the Connections to Care initiative, where we have 11 providers connecting vulnerable populations to care. This is happening in 9 counties, and When applicants submitted for funding, they identified which target population they wanted to work with. So in some cases, let's see, we have a provider who's working with the veteran population, another that's working with mothers and pregnant women. And so it's very targeted and specific with regard to vulnerable populations. Moving on. OASAS is utilizing opioid settlement funds to support the transitional safety units that were established under initially under the SAPT supplemental funding opportunity. And this is a really important service in that these are short-term housing opportunities for individuals who may be transitioning from a carceral setting. They may be transitioning from a residential program, and they have not yet secured permanent housing. And so they need a kind of a stopover, if you will. They need short-term housing that will allow them the space and the ability to continue working on their recovery while they are working on securing permanent housing. Two, the idea behind this effort is so that we're reducing the likelihood that someone will have to go into a shelter program after they've completed their treatment program or as they return to community, like I said, from a carceral setting. So great work we're doing there, or I should say the providers are doing there in 17 counties. Moving on to recovery. We are supporting 26 providers in 25 counties with regard to our recovery community centers. With the use of opioid settlement fund dollars, our providers are able to expand on the service delivery that they provide through the recovery center. So really great work happening there. And then in prevention, we are using funds to support the community prevention coalitions. And this is where we have 5 providers in 5 counties that are focusing on fentanyl, opioids, and prescriptions to address the opioid epidemic. Moving on to transportation. We are supporting non-medical transportation services. We have 12 providers covering 57 counties. With regard to media, we are utilizing the OSF for ongoing public awareness campaigns. You may see billboards, commercials, advertisements in different venues with regard to our opioid awareness campaign. And then under research, we are close to awarding our Government Academic Research and Evaluation Award. This was an RFP that we issued and we're in the scoring process, and happy to say an award will be announced on that very, very, very soon. Next slide. For the local impact initiatives, in particular, this was our effort in response to much of the feedback that we were hearing at the board meetings with regard to making dollars available to entities that OASAS perhaps doesn't traditionally contract with, or small organizations that could utilize some amount of funding to further their work. So we issued the Local Impact Initiative, and it was so that local community organizations could apply for up to and just over, I think, $9,000 each, and utilize those dollars in some way that's in keeping with the allowable use of funds based in the settlement. So we did issue over $300,000 through this work. We reached providers in 22 counties and 8 of the Empire development zones with this opportunity. Next. So in terms of implementation and outcomes, and so really when looking at like the life cycle of implementing programs, So important at the beginning to identify your purpose and what you're trying to accomplish. Obviously, there's a great deal of activity that goes into the program startup and the implementation, the service delivery, the activities. And of course, we're very interested in the outcomes and what are the results, what's the impact of the work that we're doing. And so know that within OASAS, we have our subject matter experts from throughout the agency. We have our project management team and our providers who are charged with implementing those activities. And we have regular meetings to talk about the work that we're doing on each of the initiatives funded through OSF. In terms of outcomes, we also are doing an amount of data collection with regard to each of these initiatives. We do have a team of research scientists working on the evaluation and expect that through our academic research partnership, we will add resources to the work we're doing on the opioid settlement fund evaluation. Two, with regard to outcomes, really wanting to understand the impact of initiatives themselves, but also taken as a whole, all the work that we're doing under OSF, how that's impacting outcomes across the state. So stay tuned for more information on that. Next slide. As I've mentioned, the Government Academic Research and Evaluation, RFA, was issued, and we went through a process of scoring applications. We do have an award announcement that's going to be coming out imminently, as indicated here on the slide. Know that the awardee will be receiving up to $300,000 a year for a 3-year period. Next slide. I'd also already mentioned the Leadership Institute. Know that we did issue a request for proposals to identify an entity that would provide a leadership institute that would serve anywhere from 5 to 1,000 staff working in our field. So this is specifically for middle managers, and it is a professional growth opportunity for our staff working in our system, and that award announcement is going to be made very shortly as well. In terms of next steps, know that the board had issued their first report, and it included recommendations for a 2-year period. There were revisions to priorities that were issued with regard to 2025. Also to be aware that the board members do serve, I believe, for a 3-year period. So know that there will be turnover over time with regard to membership on the board. And with that, there could be changes in recommendations. I also would expect that as our work has an impact on the community, that will also cause a change or a shift in recommendations. We also have our, as I was speaking about implementation and evaluation earlier, very important that time and energy still goes to the implementation and the ongoing activities that are the service delivery that happen. And, as a reminder, OASAS did issue 3-year contracts for most projects that we're implementing through opioid settlement funds. So this is going to be a lot of work that's going to be ongoing. And of course, the evaluation will take time. And we do see that funds will be in place for a number, or be received for a number of years. So the evaluation will be an ongoing effort and definitely a long-term effort. Let's see. So in terms of other next steps, so we do have our fiscal year 2025 dollars that we are looking to issue. As I was talking earlier with regard to regional abatement and the fact that dollar amounts change from year to year, and that there was a drop from 23 to 24 with regard to dollars. That is true in the upcoming year, and it certainly is something that folks need to be aware of as they plan and think about sustainability for the services that we've put in place so far. As I said, OASAS intentionally planned on 3-year efforts so that we could see impact from the services that we're delivering. And always, our coordination and collaboration with partners is so very important and will be an ongoing effort on our part as we continue this work. Next slide. As I said, we are joined by Val White from DOH and Chris Smith from the Office of Mental Health. Would like to provide them with an opportunity to provide any updates or comments. Val, we'll pivot to you and updates from DOH first.
Thanks, Connie. Actually, Tina Kim, our acting deputy
Oh, Tina's here. Okay, great.
for the Office of Health Equity and Human Rights, has joined for the Department of Health.
Terrific.
Val and Connie, hi everyone. Apologies, I got on a few minutes late, but I am here and that's what matters, and I'm happy to relay updates from the New York State Department of Health. My name is Tina Kim. I am the Acting Deputy Commissioner for the Office of Health Equity and Human Rights, where the AIDS Institute is based. And we have been doing a number of really exciting things, and there's some really big programmatic developments that we're excited to share about today. So thank you, Connie, for starting off with covering a lot of the significant work that OASAS has been doing. And we here at the Department of Health, we have been doing quite a bit as well. So the New York State Department of Health has announced the awardees for 2 new initiatives that will span across New York State for the next 2 years. First is the Addressing Drug Overdose in New York State, which is outside of New York City, a Harm Reduction and Health Equity Award. That went to 5 agencies in high burden areas across the state, across the rest of the state, so not in New York City, to implement interventions in high-risk settings to prevent and respond to drug overdoses among select priority populations while utilizing harm reduction practices and advancing health equity. The awardees include ACR Health, the AIDS Council for Northeastern New York / the Alliance for Positive Health, Casa Trinity, Cayuga Addictions Recovery, also known as Ithaca House, and the Cayuga County Community Health Center. The second initiative that we recently announced awardees for is for the Expanding Harm Reduction Services for Priority Populations who use drugs. 10 agencies were awarded through that opportunity, and it was intended to expand the reach of comprehensive harm reduction services and supplies and culturally comprehensive medical and social services for people who use drugs, with a focus on priority populations, including Black, Indigenous, persons of color, justice-involved, houseless, lesbian, gay, bisexual, transgender, queer, intersex plus, older adults, and pregnant and parenting individuals. The awardees include the AIDS Center for Queens County, the AIDS Council of Northeastern New York / Alliance for Positive Health, Best Self Behavioral Health, Inc., Cayuga County Community Health Center, Housing Works, Inc., the ICANN School of Medicine at Mount Sinai, Justice Innovation, Inc., National Harm Reduction Coalition, also known as Bronx Mobile, the Bridge, Inc., and the Fortune Society, Incorporated. I also want to share that the department's contract with New York Matters was executed. It is an $8 million contract over 2 years, spanning from October 2023 to end of September 2024 of this year. On June 4th to the 5th, the New York State Association of County Health Officials held the 2nd Annual Harm Reduction Symposium in Albany, New York. This year's theme was Empowering Communities for Change, Health Equity and Evidence, and local health departments were encouraged to attend the conference with their community partners such as CBOs, law enforcement, peers, and syringe exchange programs. We're delighted to report 160 attendees from across New York State went to sessions that featured speakers from local and state health departments, syringe exchange program staff, and the Legal Action Center. Our Commissioner of Health, Dr. James McDonald, provided opening remarks, followed by Joe Kerwin, who is the director of the AIDS Institute, and the staff within our AIDS Institute Office of Drug User Health worked with NYSHO to organize the event. So just a little shout out to the team within the AIDS Institute and as well as to our partners for yet again another successful event. The AIDS Institute's Office of Drug User Health has been rolling out point-of-care drug checking programs throughout New York State so that people can know what's in the drugs they are consuming and therefore make informed choices. Until now, emerging substances were detected by the coroner medical's office, after a fatal overdose had occurred or when details are revealed from drugs seized by law enforcement. So drug checking programs has been a really great preventative strategy to make sure that the drugs that are being consumed are in fact not going to cause a fatal overdose. We have been very active in issuing a number of public health alerts. On June 7th, the Department of Health issued a public health alert after our drug checking program detected traces of carfentanil in multiple heroin samples obtained in the central New York region. Carfentanil is up to 100 times stronger than fentanyl, and fentanyl and xylazine were also detected in those samples. And the public health alerts are really a great, timely way to increase awareness and make sure that that the general population is aware. And we were delighted to see a number of media outlets also pick up the information from those public health alerts to further advance the information. The samples were reportedly linked to overdoses and causing severe wounds needing emergency department care. The participant who actually brought in one of the samples informed the program that she was proud that she knew to bring the samples in and that she was part of, facilitating the creation and the distribution of the health alert to keep people safe. The participant involved in community supply in that area told the drug checking program staff to make sure we warn participants. So we will continue to do so in a timely, quick basis through our public health alerts. And then lastly, as many of you may be aware, August 31st, 2024, we are quickly approaching International Overdose Awareness Day. The AIDS Institute Office of Drug User Health here at the New York State Department of Health is coordinating the lighting of New York State landmarks in purple in recognition of all those who lost their lives to overdose. I know that there will be a number of, recognitions and things across the state in light of International Overdose Awareness Day. This will be followed by our Office of Drug User Health's annual virtual Overdose Awareness Day event on September 19th. This multifaceted event demonstrates a deep commitment to addressing the overdose drug crisis, commemorating and honoring people, and programs to collectively prioritize and elevate harm reduction skills, services, and practices to end stigma, promote wellness, and advance health equity in New York State. We will get more details out about our annual virtual Overdose Awareness Day event in September. I have personally been a part of it for several years, and it is just a really moving and just a really wonderful moment to just kind of pause and really remember all those who we lost to overdose, and really reinforces the why we do all of the work that we do collectively at the New York State level. So I just want to thank our partners at OASAS for continuing to convene this important forum, and we're happy to field any questions related to the updates from the New York State Department of Health.
Thank you, Tina. That is awesome. Also, thank you to Chris Smith from OMH for joining. Chris, if you had any comments or anything, I certainly wanted to provide you an opportunity as well.
I just wanted to give a few quick updates on the integrated care work that is ongoing within OMH. Most of it deeply involved with OASAS, none of it without them. Some of it is like hand in hand, and some of it's more consultative. One of those is in last year's budget, we got, it was $1 billion budget to really develop a whole new array of mental health services and especially housing. So just ongoing within our housing, we work very closely and expect all of our housing providers to accept residents with co-occurring mental health and substance use disorders and embrace a harm reduction approach to working with them in the entire 50,000 bed housing program that we have. And in addition to that, last year we also, I think it's still out right now, an RFP. We're developing a new short-term transitional housing program to help people coming out of hospitals, coming off the streets, to a more intensive housing transitional program to help them be able to move into more permanent housing. And again, all of those programs are expected to work with people with co-occurring mental health disorders, but we developed 5 programs statewide where everybody who's accepted to the program will have mental health and substance use disorders, and that's the real focus of those programs. We've also been working with both OASAS and OPWDD on how our clinics can better serve people with all 3 of those conditions, mental health concerns, substance use concerns, and developmental disabilities. And we're in the process of developing an RFI, a request for information, which is really kind of like a formal version of a survey that's published in the state register and is open to anybody in the community or even other states to reply to. So we're going to be seeking feedback from the system as a whole about where are the gaps for serving people, especially with developmental disabilities across the spectrum of outpatient care. So keep your eyes peeled for that if you have thoughts. And the other important update, we, working again very closely with OASAS, are in the process of expanding the CCBHC program. That's the Certified Community-Based Health Clinics, Community Behavioral Health Clinics, sorry. And we had 13 of those as part of a federal demonstration, and as part of last year's budget, we're tripling that. And the second wave of 13 programs will be going live effective July 1st of 2024, which is very exciting. Those are throughout the state, including in New York City. And the other cadre will go live July 1st of 2025. So that's a really major expansion of fully integrated mental health and substance use programs across the state. We continue to work very closely with OASAS on developing better ways for all of our clinics to be able to provide a better integrated mental health and substance use care. So later this summer, we're going to be coming out with 2 guidance frameworks for both OMH clinics and OASAS clinics. One piece is really just setting the basic minimum standard for what every clinic should be able to provide regarding co-occurring mental health conditions for an OASAS clinic, or co-occurring substance use disorder or addiction disorders for an OMH clinic. And then additionally, we're really focusing on helping clinics be able to provide a broader array of mental health and substance use services within their existing licenses. So we currently have an integrated outpatient program where you have to have 2 licenses. You have to have both an OMH and an OASAS license in order to integrate care. But we've learned a lot from that program and are now really trying to shift the focus to expanding what any clinic can do, any OMH clinic or any OASAS clinic can do to raise the bar on being able to provide integrated care throughout their program. And we expect to have that guidance and those standards ready by the end of the summer. And then the third major initiative that we're focusing on is developing a regulatory framework for a jointly licensed and overseen clinic model where people will be able to provide really no wrong door integrated mental health and substance use care. So That's a whole new sort of regulatory body of work. So it'll take a little bit more work, but we're hoping to have that ready to go in early 2025. So those are our major, really focused efforts. But so I'll stop there.
Great. That's great, Chris. Thank you. So thank you to both you and Tina for the updates, and makes you kind of proud knowing all the work that we're all doing, and that we as state agencies are making services available and certainly expanding on the work to ensure that robust services are available to folks. So thank you so much. I would like to open it up for questions. I know that there was a question in the chat with regard to the local impact initiative, and I can say that had we gotten any feedback on the initiative, and so I can say we did fund a variety of initiatives. Some included prevention, some included education, some were within the realm of recovery, and providers who applied for funds have up to a year to utilize those dollars and then report back to us with regard to the implementation of their chosen activity. So we are waiting. Providers are in the process of utilizing those funds, and then will report back to us. I can say that we did have a very positive response from providers with regard to the opportunity. Just happy to have a chance to apply for some funding and have funds to fill in a gap where they didn't have dollars to be able to meet a need. So we're looking forward to receiving additional feedback, and we'll be happy to share that with you when the time comes. Other questions that folks may have, you can feel free to post a question in the chat. So we'll wait just a moment to see if anyone has additional questions. And certainly Debbie Davis, our Associate Commissioner for the Division of Fiscal Administration, joined us. And Debbie, if you had any additional comments or anything more that you wanted to share, I certainly want to give you the opportunity.
Thank you, Connie. I think that, from a fiscal perspective, you're showing, on the tracker, for reviewing that information to see, how are the OSF funds being used. I know that we started the conversation in that perspective. We didn't broadly cover like everything OASAS is doing with all our other funding sources. We just wanted to hone in on that. I know that Tina gave us a really great overview of all the amazing work that DOH is doing. But I think that we'll work together now, and hearing your updates on some of those procurements that were released last year, that they've been, some of them awarded, and some of the work is funded by OSF, and some of the work is certainly funded by other funding streams. And also obviously a ton of work that OMH is doing in general to expand services, but also great collaborative work that we're doing with them in their service system. So any updates we're going to start making to that tracker, because obviously there's some really good stuff. So thank you all, and we look forward to continuing this work.
Mm-hmm. Absolutely. So I don't see any other questions being posed in the chat. I will check in with Lucia and Celine in case there are questions being posted that I can't see as a panelist.
Nope.
I haven't seen anything.
Nope.
Okay, great. All right. So if there are no additional questions, it was really great for this opportunity to kind of hear from OASAS, OMH, and DOH on the work that we're doing. I think from my perspective, it was great. I certainly would think from others as well. So just a great opportunity to share on the work that the state is doing. Know that these meetings are scheduled to happen quarterly. So we will see you again. It will be the fall when we see you next. So I do hope that everyone enjoys the rest of your summer. A reminder that the meeting is recorded and it will be made available on the OASAS webpage. And of course, you always have opportunity to submit questions or inquiries to the Opioid Settlement Fund's OSF project management mailbox, which is OSF project management at oasis.ny.gov. So I hope everyone's well and that you stay that way over the summer. Enjoy yourselves. Take care.